Hello and welcome. I am here to present today on the Carroll County Department of Citizen Services, and this is Carroll 101. I'm Celene Steckel, the Director of the Department of Carroll County Government's Citizen Services. I wanted to give you an overview of who we are. I think of Department of Citizen Services as three core service areas that we provide to the citizens in Carroll County. One is our Bureau of Aging and Disabilities under the direction of Gina Valentine. Another core area is our Bureau of Housing and Community Development under the direction of Danielle Yates, and then our local management board under the direction of Gabby Zalea. Our mission is really to provide person-centered services through innovative community engagement and connect the community to resources that promote dignity, independence, and an enhanced quality of life. What does this really mean? You may think of us as really the compassionate arm of the county. Excuse me. We meet people where they are, and we empower them to develop the skills to be self-sufficient or to help them access resources needed to live in the least restrictive environment, to obtain housing as they age and still be contributing members to our community. We do this across the lifespan. For example, you may have a loved one that was recently hospitalized after a fall, and your loved one has now gone into rehab to recuperate from that fall. You've talked with the social work team at the rehab, you've talked with care providers, and you understand that your loved one is not going to have the same mobility that they did before they had the fall. Now you're worried, you're wondering, how can I bring this loved one home? Well, if you contact our offices, specifically for this case, the Bureau of Aging and Disabilities, we have Maryland Access Point specialists there that can help you walk through that process, because in most cases, we know that people want to remain at their home as they age. And we can help you with an options counseling session to help you identify what services exist right here in Carroll County to keep that loved one at home where they want to be, which ultimately I'm sure is your goal as well. The Department of Citizen Services is funded through several different funding streams. We access a lot of grants and also pass-through funding from federal funding, state funding, and we also get support from our local general fund dollars here with Carroll County government. How do we do what we do and the services that we provide? I've already talked about our three core agencies within the department, but we cannot do what we do without the community boards and commissions that we rely on to advise us on the needs in our community, as well as those community partnerships with local nonprofits, faith-based organizations, and many others that help us to support everyone in this community. The Bureau of Aging and Disabilities is dedicated to providing the highest quality of services, programs, and assistance to promote choice, dignity, independence for older adults, adults with disabilities, veterans, and those who care for them. We serve primarily older adults aged 60 plus and individuals with disabilities of any age in Carroll County. This slide represents just a few of the many programs that are housed within the Bureau of Aging and Disabilities. This slide is not a comprehensive list of the services, but I do want to highlight a few of the services that are listed on here. One is our state health insurance assistance program. Many of you hear the term Medicare, you're familiar with what that is, but you're not familiar with the interworkings of Medicare and how it really rolls out when you're looking for insurance for yourself or a loved one who's aging and what things are covered. We have a Medicare counseling program with long-tenured trained volunteers and also a paid staff through grant funding from the federal and state government, and they will assist you with questions about Medicare, Medigap, HMOs, long-term care insurance, qualified Medicare beneficiaries, and pharmacy assistance. We also have our long-term care ombudsman program, which includes our elder abuse awareness program. This program is mandated under the Older Americans Act, and it provides very unique advocacy services for the most vulnerable citizens living in our long-term care and assisted living facilities throughout Carroll County. We have two ombudsmen that go out into the facilities. They visit these facilities, identifying, investigating, documenting, and resolving any complaints that residents of those facilities may have. During this time, they also promote resident rights and ensure that our residents in our facilities are attaining the highest quality of life possible for them. And we look to empower these consumers with information to navigate the long-term care system. Our senior and community centers are another really big piece of the Bureau of Aging and Disabilities. These are one of our most forward-facing facilities throughout Carroll County. We have many people that come through the doors of our centers. The 5 centers offer educational, social, recreational, fitness, health, nutritional, informational opportunities for seniors age 60 plus. We also offer congregate meals to promote nutrition, but we also do this to promote socialization because we serve these meals in a congregate setting, allowing people to talk with each other and have interaction, especially those that don't have that ability or have anyone else that they're living with at their home. We also partner with sister agencies across the county to provide classes, health screenings, disease self-management programs, nutrition education, and also hire certified fitness instructors, as well as providing volunteer opportunities for older adults. Our senior centers are located in 5 points across the county: Mount Airy, North Carroll, South Carroll, Tawnytown, and Westminster. Even though we have 5 centers that offer similar types of programming, each center has its own dynamic. We may have one member that has joined at one location, which allows them to visit any of our senior centers across the county. And they may go to one class on a Monday at one center, but then choose to go to another option at a different center later in the week because they enjoy the different dynamics offered at each center. We also offer signature events. So some of those include World Elder Abuse Awareness Day, our Seniors on the Go Expo, and we also, through the Bureau of Aging and Disabilities, have another very important tool in our pocket, and that is our Commission on Aging and Disabilities. The Commission on Aging and Disabilities mission is to represent the Bureau of Aging and Disabilities and to advocate for the needs of Carroll County's older adults, individuals with disabilities, and veterans to ensure they receive the highest level of service, assistance, and programs. One of the best pieces of the commission is that we have representation from all the different municipalities on the commission, as well as the different populations of older adults and people with disabilities and veterans throughout the county. And with that representation, they bring back and are the liaison to their community information to us so that we better understand the needs of Carroll County citizens. And we base our program designs and any opportunities we have for increasing services on the reports back from the commission. We also have a Veterans Services Program that's located within the Bureau of Aging and Disabilities. Their mission is dedicated to promoting the interest and welfare of veterans who have served in the Armed Forces of the United States of America, their family members, and survivors. The program focuses on enhancing the veterans' quality of life and improving outcomes through advocacy, claims assistance, education, counseling, and facilitating access to other appropriate human services programs. Our Veterans Services Program provides many different services. I want to highlight a few of those. We do have on-site certified Veterans Service Officers who can assist with preparing and submitting pension and benefit claims to write directly into the Veterans Benefit Administration system. We also have a Carroll County Veterans Shuttle Program that will transport our veterans to locations with VA medical clinics outside of Carroll County at no charge, and a caregiver can accompany their loved ones as well. We also have the Veterans Assistance Program for those at risk of homelessness, and we also have a Veterans Advisory Council, another very important tool in our toolbox when working with our citizens. The Veterans Advisory Council provides support to our veterans programs and services by advocating for the needs of our veterans in the community. One other piece that we do is we assist veterans in obtaining their military discharge or their DD-214, which many of you know is the document you must have in order to start the process to access benefits through the system. And as of May of 2020, our Veterans Services Program of Carroll County has submitted over 3,100 claims to assist over 1,400 veterans and their family members in obtaining more than $35 million in benefits since the inception of our program in 2013. I want to move on now to our Bureau of Housing and Community Development. The Housing and Community Development is our arm of our Public Housing Authority for Carroll County. We administer our Housing Choice Voucher Program in compliance with HUD's Section 8 regulations and federal, state, and local fair housing laws. And the jurisdiction of our Public Housing Authority is Carroll County, other than the City of Westminster. The City of Westminster houses their own Public Housing Authority. The mission of the Bureau of Housing and Community Development is to promote adequate and affordable housing, economic opportunity, and a suitable living environment free from discrimination to eligible low and moderately low-income persons who live or work in Carroll County, to encourage self-sufficiency among participating families while managing their resources. So our Housing Choice Voucher Program consists of 773 tenant-based Housing Choice Vouchers that consist of 524 regular Housing Choice Vouchers and 249 specialized vouchers. They're non-elderly disabled vouchers, family unification vouchers, Veterans Affairs supportive housing vouchers, and mainstream vouchers. These all support low-income families, the elderly, disabled, to be able to afford decent, safe, and sanitary housing in the private market. Since housing assistance is provided on behalf of the family or the individual, participants are able to find their own housing, including single-family homes, townhouses, and apartments, whatever they need or want to fit their need. Family Self-Sufficiency Program is another very important program within our Housing Bureau. This program is better known as Thrive, and it allows HUD-assisted families to increase their earned income and reduce dependency on welfare assistance and also rental subsidies. Ultimately, this helps people leave our Section 8 voucher, our HUD voucher program, and to be self-sufficient and purchase their own homes. They do this by us offering multiple services that we coordinate through this program, and also for each individual, we have an interest-bearing escrow account that's established through our Public Housing Authority for the participating family, which then can be allocated back after they've completed their time in the program to use as a down payment for their own home, which is such a successful and rewarding feeling. So, we also have our livability program where we do our livability enforcement. So our Housing Quality Standard Inspector handles all livability matters for the county and is required to enforce Chapter 171 of our livability code under Carroll County's code. And we work very closely with permits and inspections to enforce this and rely on their expertise regarding the code as well. When I talk about our partnership and collaboration, the Circle of Caring Homelessness Board is where the compassionate arm of Citizen Services is fully realized. The vision of the Circle of Caring is one community, a home for all, and the mission statement is to empower all citizens of Carroll County to be self-sufficient, have stable housing, and a safe, healthy life by maximizing community collaboration. The Circle of Caring Homelessness Board is where all the partners come together. Our partner agencies consisting of nonprofit providers, faith-based organizations, healthcare providers, soup kitchens and pantries, education providers, those with lived homeless experience, and concerned citizens, and everyone comes together for this common mission. The Circle of Caring Homelessness Board was originally designed by the Board of Carroll County Commissioners in 1997 as a voluntary board of concerned citizens. The Circle of Caring works to develop, communicate, and support strategies that respond to the needs of persons who are homeless or at risk of homelessness in Carroll County, Maryland. In short, our purpose is to work together and to prevent and end homelessness. There is also an executive arm of the Circle of Caring that is tasked with putting to action the recommendations of the Circle, and this is done in part with funding through the Continuum of Care Homeless Assistance. The Department of Citizen Services serves as the collaborative applicant to the state of Maryland for funds to plan for and address the need for homeless services in our geographical area. We do this through 3 different projects currently: the Shelter Plus Care Project, Permanent Supportive Housing, and Coordinated Entry. The Homeless Management Information System plays a large role in our application for the Continuum funding. This is where we maintain the Homeless Management Information System and data, and this is where all of our allied agencies enter their data on the services they're providing to our homeless individuals throughout the county. That includes HSP, our shelter provider for the county, the health department, the Bureau of Aging and Disabilities, Access Carroll, and several other partners. This data is required in order for us to have funding through the Continuum of Care, and it's provided to the state and federal government, who monitors our data to ensure that we are performing in our program areas. Another piece of the Department of Citizen Services is our local management board. This kind of wraps us full circle because this is where our children's service providers come into play. Our local management board builds and facilitates partnerships throughout the county to create an effective system of services, supports, and opportunities to improve the quality of life for all children, youth, and families in Carroll County. And it also serves as the coordinating entity for Carroll County's local care team. The Local Management Board is responsible for building and supporting this infrastructure for children's services throughout the county. This slide contains the different programs developed by Carroll County's Local Management Board. The different programs are supported through funding received from the Governor's Office of Crime Prevention, Youth and Victim Services. As you can see, we all work collaboratively with our local nonprofits to develop services for areas of need. The Local Management Board is tasked with oversight and administration of our local care team. The local care team is designated by the Children's Cabinet to be the central point for coordinated case management and as a point of access to services for children and youth. The mission of the local care team is to provide local community-based resource connections and supports for at-risk youth in Carroll County. The local care team requires local agencies to attend all local care team meetings and to be represented by staff of those agencies who can actually commit those resources. This was a piece that was found to be missing in the past, and this has been a very effective resource for our local families that have really had some crisis situations where they had worked with multiple providers but still had not had success. This is a way to bring all of those providers to the table with the family and address how that can be better, how their care and services can be better facilitated to meet their needs and on a collaborative basis, and really work through that and the follow-up to make sure each agency is doing what they committed to do, and then our families can have success. The department has several special projects that we're working on. This list is just a select few that I wanted to highlight. One of the biggest and most exciting pieces is that next year, in 2022, we are celebrating the 50th anniversary of the Bureau of Aging and Disabilities. We also are working with our Commission on Aging and Disabilities with their subcommittee called Carroll Together, which is an Aging in Place subcommittee, to work to obtain an age-friendly community designation, which is through AARP, for Carroll County. And as we look forward to that development, we will be reaching out to the community and some of you to assist and help us get that designation, because it is a community collaboration to do that. We also have a special project within Carroll County's Bureau of Housing to develop HUD-certified housing counseling programs within Carroll County, specifically within our Bureau of Housing. Currently in Carroll County, there is no certified housing counseling program through HUD in the county. So we want to make sure that that resource is here and hope to have that to you within the next year. We also have a special project through the Local Management Board to develop strategies to incorporate intentional efforts that address and reduce race equity issues and reduce adverse childhood experiences through trauma-informed practices. Our Continuum of Care Family Shelter Relocation Project is another special project where we're looking to identify and acquire a space to relocate our current homeless family shelter. So what does all of this mean to you, right? I've talked about a lot of different services, a lot of different programs that we offer, but what does this really mean at the end of the day? The Department of Citizen Services is always working behind the scenes to meet the needs of our county's most at-risk individuals. At the leadership level, we're identifying gaps, seeking partnerships, convening work groups to address those gaps, and we also seek out potential funding or advocating for system changes to allow the needed services in our area. At the boots on the ground level with our staff, they are directly providing services and resources and resource connections to people across the lifespan. We also have our staff empowering people to be contributing members of their own community by promoting dignity, independence, and enhanced quality of life. That's the end of my presentation. If you have any questions, I'd be happy to answer them. You can also reach out. Our contact information is on the screen to Gina Valentine or Danielle Yates or myself directly. I hope you've enjoyed this presentation, and we hope to work with you soon.